Hello, everyone. My name is Thomas Duncan. I'm the Trauma Medical Director at Ventura County Medical Center, and I'm glad you're joining us to view this video. It is very informative, and hopefully it will give you some ideas of how to prevent injuries. Give me a few seconds to start sharing my screen. Today, we'll be talking about injury prevention. Injury prevention is very important because this is one of the mechanisms in which we prevent injuries from happening to our community. November 18th is National Injury Prevention Day. It is the second annual National Injury Prevention Day that has been started by our injury prevention experts. The truth about injuries and violence is as such. It is the leading cause of hospitalization and death of children and their family members between the ages of 1 through 44. Injuries are mostly preventable. Hence, the term trauma is no accident. We can prevent some of these injuries from happening by having our preventive mechanisms in play, and we will talk a little bit more about that later on. You can help light the way towards injury prevention by being involved. Now, we'll review some of the data at Ventura County Medical Center. We admit anywhere from 1,200 to 1,400 patients per year, ranging from adults to children. And these injuries are either falls, motor vehicle crashes, gunshot wounds or stab wound victims, motorcycle crashes, assaults, pedestrians hit by autos, or bicyclists or skateboardists, or those riding scooters hit by cars. We have several injury prevention efforts in our armamentarium at Ventura County Medical Center. We have an elderly fall prevention program, which is involving the Ventura County Area Agency on Aging. You can go to vcAAA.org to determine exactly what programs we have. We have a violence intervention program called Emergency Entry to Exit to help those that have been involved in a violent act and to prevent them from coming back as repeat victims of violence. There's a car seat program in which we provide car seats to those that are unable to afford them, and a bicycle helmet program, which has to do with giving a helmet to an individual who had a bicycle crash or skateboard crash, whose helmet got injured or the helmet was never worn in the first place. And we also partnered with the American College of Surgeons for a Stop the Bleed event, which is a mechanism for teaching people how to use tourniquets or to stop bleeding. If you go to the website, it's called stopthebleed.org. You will see a picture of Ventura County at the opening page. There's pedestrian safety, which is something that we're concentrating on, and also cycle safety. In reviewing our data from the past 5 years, meaning 2015 through 2021, we have mechanisms of injuries such as auto versus pedestrians, meaning people walking. And the mortality rate in 2019 was 19%. So out of 73 individuals that were hit by a car, 14 died. We are fortunate that the percentage thus far this year is only 8%, but our numbers are at 62 year to date, and we're not at the end of the year yet. So we're climbing up there, and we hope to be able to decrease this number. The most common occurrences in the Oxnard area are in the zip code 93030 or 93033. And we need to focus our efforts in those zip code areas to decrease the number of incidents of people being hit by cars. In the Ventura area, it is 93001 and 93003 zip codes where people are being hit more so. In Santa Paula, the distribution is spread out equally. In terms of the most common injuries that we see when people are hit by cars, in 2017, we had a high number of injuries ranging from those with hip fractures or pelvic fractures, rib fractures, leg injuries such as the bones in the legs and arms, and concussions. In 2016, we had 26 concussions, which is pretty high compared to all the rest of the years. But pelvic fractures and hip fractures are highest in the total number of injuries that we see in patients that come into the emergency room. In regards to bicycle crashes, in the year 2019, we saw a mortality rate of 11%. So out of 27 individuals that were hit by cars riding their bicycles, 3 died. In 2021, we're not done with the rest of the year yet, but we're up to 47 individuals who've been hit by cars while they're riding their bicycles, which is the highest number we've had over the past 5 years. The mortality is 6%, but we do not want that number to go up any further. The most common areas where people are being hit by cars in Ventura are, particularly in Oxnard, are the 93030, 93033 area code, which matches those that are being hit by cars while walking as pedestrians. In the Ventura City area, the common areas are 93001 and 93003, which also matches those being hit by cars by walking. In Port Hueneme, we had minimal numbers over the past several years, although this year we have up to 4 individuals who have been hit by cars while riding a bicycle in the 93041 area code. The most common injuries for those hit by cars while riding a bicycle are concussions. The concussions are high up there. And then the other injuries like pelvic fractures or rib fractures or bony injuries of the legs or arms follow that. And then we have spine injuries. This year, we are at 7 for the number of concussions. And the highest number we've had is 10 in 2016. But as you can see, we're not done with the year yet. So this number could go up. Our goal is to prevent the number from going up any higher than it is. As such, in looking at the data, we need to do collaborate with other entities. We've done geomapping to determine where these injuries are happening in the different area codes, and we need to zone in on neighborhoods to figure out exactly where they're happening. If there's a common neighborhood, we need to do more injury prevention in this area. We're going to partner with public health, law enforcement, NHTSA, National Highway Traffic Safety Administration, and the cities to determine how to bond to conduct injury prevention efforts for our pedestrians as well as our cyclists. Some of the safety measures that we can do as pedestrians is, first of all, obey signs and signals of the road. Use sidewalks if there are, but if there are none, face traffic as you're walking. Limit distractions. There's so many times when I see individuals walking with their cell phones, either talking on them and being distracted or texting on their cell phones. This is a recipe for disaster. Use the crosswalks. We have a crosswalk at VCMC right across from the entrance, which many people do not use. It is a crosswalk in which you can push a button and it lights up. And when you're crossing, the motorists can see the light of the crosswalk and hence are alerted that you're crossing. We put that there strategically because we had people being hit by cars. It is rarely used. Please use the crosswalks. Make eye contact with drivers. If you make eye contact with the driver is more apt to pay attention and not hit you. Wear bright clothes if you can. It's not possible, obviously, for those that do not have a variety of clothing, but if you can, wear bright clothes if you go walking, and use a flashlight at night. Do not wear dark clothes at night. It is a recipe for disaster. I've almost hit more than one individual at night because their clothing was so dark that I couldn't see them. Watch out for cars entering or exiting driveways because a lot of times some cars do not have rear view cameras to see you. So be careful about that. And obviously avoid alcohol or drugs because it alters your perception in terms of being able to make good decisions and walking into traffic or being hit. Bicyclists need to wear helmets. That's without any saying at all. But we see some that don't wear helmets and have traumatic brain injuries or bad brain bleeds when it happens. Obey the traffic signs and stop signs. You want to ride along with traffic and use bike lanes if they're bike lanes. Be predictable. If you're going to make a turn or switch in and out of lanes, make it be known to the motorist and be conspicuous. Similar to when you're walking, wear bright clothing or reflectors or use night lights. And you want to maintain eye contact also and think ahead. Be defensive. In terms of that, you want to be alert of the fact that there may be a pothole in front of you and avoid it, or there may be some rocks, slippery rocks that may cause you to fall. Avoid that. You want to be ready in terms of having your tires or changed or brakes checked. Now, we are fortunate that we will be part of the Green Lights Awareness Campaign, which will be happening on November 18th. The lights at VCMC will be green, neon green, in recognition of Awareness of Injury Prevention Day. We want to thank Dr. Fankhauser for being supportive of this effort. We want to thank the trauma staff, particularly Danny Yamboa, for providing the data for us, and Ashley for spreading the word, as well as all those involved in the taking care of trauma patients in our hospital. There are too many to name, but I want to thank every single one of them who have been so helpful in this process. So be safe, and we will catch you next time. I want you to have a great day, and we'll see you later.